presentation is focused on epidemiological profile of cancer in Venezuela and some aspects of the cancer program. As you know, Venezuela is a septentrional region of South America. It's about 960,000 kilometers square, about 28 million inhabitants, 23 states and capital district. Two-thirds of the population of the country are situated, established in the septentrional area region of the countries, between west and east, and the rest of the country have low population density. The cancer control was established in Venezuela in the decade of 60s as a component of chronic diseases program of the health ministry. At the beginning, the program was dedicated to promote the practice of the pap smear and supply the resources necessary for this test at first levels of medical care of Caracas. Progressively was extended to the rest of the country. Only this was in the first year the only activity of the cancer program. In 1976, the program achieved an extraordinary impulse with the presidential decree that the establishment the oncology direction of the Ministry of Health, with budget assigned to the program and with personnel and other resources that made the program achieve an importance in all the country. In the decade of the 90s was established the official guidelines of the cancer program, and the program was based on the education, basically promotion, and in the terms of screening, basically cancer cervical screening and breast cancer screening with certain limitation. And in the west of the country, the region of Andes, a program of screening of gastric cancer. In this guideline, the cancer was defined as a process directed to organize resources, appointing to reach viable objectives, and using valid strategy with the aim of reducing morbidity and mortality for the most frequent and especially the most vulnerable localization of cancer, appointing to the major risk groups. The cancer control program was established on the basis of the principle of promotion a healthy style of life, prevention of the illness, and improving the care of the cases of cancer. The main objective was impulse in activities as promotion of the health, encouraging people to healthy lifestyle through the research and education division of the oncology programs. Second, early diagnostic, promoting cancer screening tests, effective and opportune medical attention, increasing access to good cancer care, and control and evaluation of end results, improving the quality of the information system, establishing the cancer registry with a base on hospitals. The cancer control program is supported with appropriate knowledge of epidemiological profile and the knowing of natural history of main cancer types, as well as an efficient system information evaluation of the end results. So we follow the criteria for cancer screening. And this matrix is used and know for you that establishes certain requisites that are necessary to consider a cancer susceptible to a program of prevention based on screening. Service, of course, is the situation more favorable in this sense. Second, breast. Other cancer are not join all the requisites. I am going to show now the epidemiological profile of cancer in Venezuela. That is the guide for the select for choice the type of cancer that must be screened. Cancer in Venezuela is the second leading cause of death. That's the last year we have official data, 2009. 27,000 deaths was for disease of heart. Malignant neoplasm was the second position, 96 deaths. But when we see the 10 main causes of specific causes of death, we in male have two types of cancer: malignant neoplasm of prostate, cancer of prostate, and of the lungs and lungs. Female, we have in acute myocardial infarction at the third place, and malignant neoplasm of cervix uterine, as you can see, is in the fixed position, and breast cancer is always now in the fourth position. We used to incident estimate main causes of cancer in male and female. This show in males prostate is the first place. Of course, is excluded skin cancer, which is the commonest type of cancer, but the estimations are not crossed. Second is lung, stomach in the third place, colon and rectum is fourth. Females, we have breast now in first place, second cervix uterus, colon and rectum in third place, and lung in fourth place. What's main causes of death by cancer? Male prostate is the first place, more than 2,000 deaths in year 2009. Stomach, lung second place, and stomach third place. Females, breast, 1,643 deaths. Cervix uterine, uterus, 1,566, and lung, 1,184. It's important to see the situation of some of the most important types of cancer around the country and compare the states with standardized rate of mortality or incidence. And you can see for all types of cancer that there is the mean rate, and there are states over the main rate of another place. This is the mortality, incidence, more or less the same. But when we see some type specific of cancer, like cervicular, you can see that the difference between states are striking. So we have a lot of states over the mean rate, and others below the mean rate. Here, this difference is basically because of the coverage of the cytological program. The states that have better coverage have the less rate. The states that have poor coverage have the higher rate. The same is in mortality, incidence. The standardized mortality for breast cancer. Here you see the contrary situation that we saw in cervical cancer. Here the state that has better income are in the first, like Capital District, Aragua, Carabobo, Zulia, Miranda. And the region of the less income are with the rate low.